Welcome back or welcome if this is your first time visiting. This is Heart to Heart, Less Leg, More Heart's peer virtual support group meeting that meets the second Thursday of every month at 6 p.m. Eastern. You can register on our website in the About section under Heart to Heart. This is a free resource for the limb loss community that brings health and wellness experts to you, where we discuss topics that are relevant to the disabled community, specifically amputees. We were supposed to be talking about stem cell therapy tonight, but we have punted that to December for administrative reasons. So tonight we're going to use the opportunity toward the end of this year. We need to set ourselves up for success in 2024. And I wanted to make sure that everybody in the disabled community understands Social Security, what SSDI is, what SGA is, how much you can make, what you need to do to keep yourself protected if you are receiving benefits, to ensure that those benefits are not asked to be paid back or checks to be held in the future, which is the case for a lot of people that I've mentored that I catch after the fact. So with that being said, I've asked the group a couple of questions, and it seems like we want to start out with a little introductory information. So the first thing that I want to mention to people is that there is a website that you can go to, ssga.gov, and that is the kind of like primary, right from the horse's mouth information about this topic. So most people know that when you become disabled and you become labeled as unable to work or obtain a substantial amount of gainful activity to be able to live, you can apply if you have a permanent physical disability that is not expected to improve within 12 months and or could lead to death, that you can apply for the benefits of the federal government. And if you've had enough credits, which we can discuss in a minute, or you also have had enough earned history where you've had taxes taken out over a period of years prior to that disability, you can qualify for money. SSDI is different than SSI, and I briefly want to cover that, just 2-cent tour real quick. So SSI, Social Security, I'm gonna read to you what I've written down just to make it easy, because I wanted to pare back the information for you today. So here it is. This is the easiest form for me to tell you about. All right. So SSI is for people that have low income and that have few assets. It comes with Medicaid and maximum check amounts of like around the $900 per month mark, which, as you know, with the state of the world and inflation, is awful. SSDI is for people that have worked for around 5 of the last 10 years. It comes with Medicare health insurance and an average benefit amount of, this is average, it varies from person to person, of $1,350 per month. The I know not everyone gets it. The
the thing is, I get both of them, but I don't even get close because I was so young. So I didn't put a lot of time in from working to have work credit built up. So they give me like nothing on that, but I get both of them.
I want to hear all about that in just a minute. I do want to dig into that, because that's helpful for other people to know that you can qualify for both. SSI, so Supplemental Security Income, provides the benefits based on the financial need, not on work history, which is what he's alluding to. An SSDI, Social Security Disability Income, is for benefits to disabled people based on prior earnings and work history. The difference primarily is not in just the qualification, as I mentioned, but it's also like there's different wait periods and different amounts, and they come from different places, different pockets in the government. So SSI, right, the Supplemental Security Income for people that are based on financial need, that's no wait period, and the benefits begin the first of every month, and it's coming with a lower amount. But the SSDI is a wait period after you've applied and been accepted of 5 months, and it's after you've become disabled. So
you'll always get denied. Usually the first time, the second time, or the third time, you usually get denied. You have to get a lawyer. If you don't, you're going to be denied and have to wait extra long.
Yeah, there are bits of that are accurate, but there are also some pro tips that I can help share to reduce that. What Stephen could be alluding to is, when the Social Security Administration looks into whether or not you're going to be deemed to be eligible, there's an actual qualification listing, and there's also a spreadsheet of information that you can determine your eligibility before you even go and do the application process. And if this is something that you haven't applied for, but you feel like you should to supplement your income, or it's something that you feel like you were wrongfully denied on, I would advise 2 things. You have to do research on the eligibility qualifications, and you have to do research on the specific disability criteria that are utilized in the determination. Because if it's not written in the right way, even if you have qualifying diagnoses or conditions, if things are not, if T's aren't crossed and I's aren't dotted in a very specific manner, the computer generated or autopilot person doing stamping could go past it and refuse it. And a lot of people do get those refusals on the first application. And then it becomes harder. Then you have to challenge the system. As Stephen had mentioned, you oftentimes have to hire a lawyer to actually go after them in the legal jargon that's needed. But you can get ahead of that sometimes in not taking a quick lure. So if you go on the website, I'm going to drop some information here in the chat real quick. Where is my chat? Someone send me a message in the chat because for some, oh, here it is. Okay. I'm going to send you guys this link. So this, and I will post this on the playback on YouTube that we're going to be putting up. The first thing I'm going to share with you guys, and I want you to pull it up on your computer or your phone if you have it, is the checklist for online disability application. Even those of you that have already applied, I would still like you to look at this because I think that there's some good talking points in here for people that have applied like you, Stephen, or myself or other people, so that we can kind of like highlight some, you know, the things that are between the lines for other people. The second document that I want to put up for you guys to start reading through and to share is the qualification website from the Social Security Administration, which has links. And the third one and the final one that I'll put on you, too much is too much information, is from Forbes. This document is really great about advising on Social Security. And between these three resources, you really can find most of the things that you need to find about the basics. There's an application direct link, there's the qualifications, there's the inclusion criteria. The first thing you would do if you have a disability and you want to get on this is you would look at that checklist, that first link that I sent you, and you look through like, what are the things that I need, the information that I'm going to need to have handy, because they do have online application process. And if you have all of these things ahead of time, you can basically just go in and fill out all the information and be done with it within the hour. And then you just sit and kind of wait for that information back. So the first step is harvesting the extensive list of items. And some of them are pretty time consuming, like getting documentation from physicians. And I mean, there really is a lot of labor that goes into the front end of this. So that would be the first step that you would want to look at. After you do that, you have to have specific information about all of the medical records and job history and education and training that you've done, because what they are trying to determine is there a case on their end for them to deny you coverage because your capacity is not totally and permanently disabled. And that doesn't mean that you are a slug out there not being able to do anything. In fact, when you get on Social Security, you are allowed to make money every month in gainful employment that is taxed by the state and the federal government. And right now, so that's called SGA. So you go through the applications process. Let's just play it easy first, right? You apply for it. I gave you the links. You get a thing back that said, we think that you're totally and permanently disabled by Social Security. Here's the amount of money that we're going to give to you. And so from that point of approval, you have a 2-year wait before you get health insurance for Medicare. That's the comment number one that we have to talk about. So you're approved, but you don't get your Medicare for 2 years. So you're in a hole, right? The second piece is that from that moment moving forward, you have the opportunity to have a part-time job or a full-time job if it paid not very much. And you can make the minimum, the maximum of their definition of SGA every month. And that changes every year. So for 2023, SGA, substantial gainful activity, the amount of money that you can make clearly through paychecks is $1,470 or something, I believe, right? 1,400, and we'll double check it as we go through it, but it's in that realm. Yeah, it's $1,470 in 2023. If you are blind, that number is actually higher. So if you are blind as part of your disability, you actually get 2,460 as the bracket. So there's different criteria as to what you can make. But if you are a person with just a physical impairment that doesn't have a visual impairment, you are only allowed to make 1,470. And I need you to understand, before you go out earning, if you are on Social Security, do not make more than 1,470 a month in gross payment.
Otherwise, they'll stop your payment. Yeah.
Well, so they will not only stop the payments you're receiving, in a number of cases, I know people that have actually had to repay tens of thousands of dollars for lack of reporting to the Social Security company. And I don't want to say that to anybody to dissuade them from working.
Yeah.
I want everybody to be out there pursuing their passion and their purpose, promoting good community, helping with taxpayer money. Like, I think that that's amazing. And it's help, and you can do it. But the two things you have to make sure you safeguard are that the check amount in total prior to any deductions that are being taken out is no more than $1,470, which means that your take home is going to be usually in what, like $1,200 range after all the taxes are taken out. And that's fine because it keeps you safe. The piece you have to remember is that you must, I need to say it again slowly, you must keep documents of all of your pay stubs. And people have said this to me before, but I will share with you something. I'm on Social Security disability. I have a condition that affects both of my legs and makes me unable to do a lot of things, walk, work, etc. In that instance, because I've been deemed totally and permanently disabled, I'm just going to use me as an example that we can work through. I went through the application process, and then I began with my disability, and then I had a 2-year wait where I had no health insurance because Medicare doesn't kick in. So what I did, and this could be different from everyone, and I'm looking forward to hearing other people's opinion, I went to healthcare.gov, which is the marketplace health insurance, and I did their open enrollment, which actually is active right now. Their cap is December 15th. So if you need better health insurance or you need health insurance, go to healthcare.gov right now before December 15th. The great thing about that platform is that you can compare insurance plans against each other. So you can actually put in medications you take, doctors you see, things that you need, DME coverage, which is what prosthetics fall under, and it will auto-generate the best policies for you and the best couple of them that you can then look through to see what premium's best for me, what out-of-pocket's best for me, what coverage is best for me. And then when you select it, they also factor in your income. And if you are a low-income person, it will reduce what you owe. So it's actually a nice little fill in for people that are uninsured or waiting for their Medicare to kick in after they've been disabled, but also it might be a better plan in general for some people that aren't on Medicare and don't have SSDI. So putting that out there, I got the marketplace health insurance. I waited 2 years for my Medicare, and I also started working, doing as much as I could do to keep my brain active. And I knew, this is back in 2018. At that time, the SGA was only $850. So you could only make $850 a month for your life. And I would make that. I would try to get as close to it as I could. And I've kept diligent, records, always keeping pay stubs. And I have a digital database so that even paper can get lost or burn up. I put everything into Google Drive so that I have no issue accessing that. Now I'm at 5 years. So Social Security has contacted me earlier this year, and they said, we need you to show us proof of all of your payments because they will auto-generate. I just want you to see what's behind the scenes, and I wish I had pulled it out today to show you. What you get in the mail is a packet, and the packet says you're up for re-eligibility based on these years and these months. We need to reassess, not just, so there's two parts. There's your work history, meaning you haven't made over that SGA for all of the 5 years every month. And then there's the second part, which is the medical evaluation to determine that your medical circumstance hasn't significantly improved. And that piece is easy if you see the doctor and your circumstance is the same that it is or worse. But for the work history piece, I really dug into Social Security. I spent hours on the phone trying to learn everything I could to share with you guys, because this could literally ruin your ability to live. It's a kind of a big deal, right? So I asked, where do you get, first of all, the paperwork that came to me had the wrong information. There were several months that it showed that I earned nothing, which was not true. I've been consistently making something in some way every month. And then on some months, it was $3,000 or $4,000, which is not true. I've been very, very cautious to ensure that I stay below SGA. I have a son to support and I can't work right now with my legs and the surgeries I have coming up. So I started to panic, as anybody would, right? Like your viability and your livelihood is being threatened. So I called them, and you spend an hour and a half on the phone trying to get somebody on the phone, and then you get somebody on the phone and they don't care about you at all. It's like, is it a computer generated person? It's just, they're telling you straight lines. And I finally just said, how do you guys determine the number that goes in those cells for what we make? Because it's wildly inaccurate. And she said, we get documents from Equifax. So they get a number from an annual reported number that they then divide into 12 months of the year. So even if you didn't work from January to June because you had surgery and you didn't make any side money, and say then you work from July to December, whatever money at the end of the year is a total, then gets divided into all the months. So if, as you can tell, there's like a lot of room for error, and those monetary amounts that you're judged on a monthly basis that qualify you, they check it monthly, can be significantly off from what you actually made. And the only way to prove it wrong is to provide the Social Security Administration with a printout for your documents of your pay stubs. And what I'll tell you is what they want is they want the check date, they want the pay range date, and then they want the amount. And each of the pay stubs has to have all three of those to be validated. So if you're organized and you keep these things, which you just have to get into a system of doing, and it isn't that hard once you get the system down, it's really easy. It was really easy for me to go back to them for 5 years of every single month and go, y'all are wrong. Like, don't disqualify me. And I was able to provide them that. But had I not, I would have wrongfully been removed from my ability to live because of their system errors. So that's the first piece I want to highlight is know what the SGA is every year. So it's gonna increase in 2024. I don't think I know that number just yet, but 1470 this year. It'll go up a little bit next year. Stay under that number, at or under that number with gross income, and make sure that you document, you maintain every pay stub, and you keep it, because they will come back and ask. A lot of people have tried to get away with it because you don't hear from them. You get the application, you get the approval, and then it's just like, oh, and they throw you, you just get to do whatever you want. And you don't know how direct oversight is. And because of things like the pandemic and other political things that occur, the system gets backlogged. And sometimes they come at you way longer than what you thought that they were going to be coming towards you at. So as long as you're prepared and documented, you're going to be okay. But if you're not, it really could threaten your viability. And I don't want that to dissuade anybody from working. So what I first wanted to ask is there anybody that has heard of or has participated in that's on Social Security disability income? So you are on SSDI and you have heard of and performed the 9-month back to work trial.
Heard of it, but haven't performed it.
Okay.
No,
So
yeah.
so I've done both. So I want to walk people through that because I think there's a lot of confusion around it. The 9-month back to work trial is a system set up with your SSDI where for 9 total months, they don't have to be back to back, but you are allowed. So say you get a form. I'm just going to show you this. You're going to get a form back from Social Security at your reevaluation that has lines like this. And it's January, February, March, April, May of each year. And it shows the month and the year, the SGA limit that's allowed, and then what it is that they have on file that you made. And then there's another column that says qualify for benefits, and it's either a yes or a no. So if your number you made based on their reporting, which is sometimes inaccurate, is higher than what you were supposed to get, it will say no in that last column. You are only allowed 9 no's in that column before your disability benefits are threatened. So those 9 months are considered a back to work trial. You're allowed like 9, the way that I view it, like 9 whoopsies, if that is in fact what it is. However, if you're smart about it and you stay ahead of it and you start now with it and you keep everything under your SGA, say you want to try a job for 9 months. You want to see if you can perform, and you also need to supplement your life with some finances because it's tough to get by. When you go and get a job, try to make, don't tell them that you're coming off disability. You don't have to tell them that you're going to leave in 9 months. You're going in to help perform what you need in your life. So you want to go to a job that you make as much money as possible, right? Because doing what it is that you love to do. I'm just helping in the most perfect financial realm. That would be what you would do. You're coming off your disability. You get the highest paying job that you can get in your capacity. You still earn your full benefits and you get your full salary or hourly rate, whatever it is, for your work. So say your benefits are $1,200 for your SGA, or I'm sorry, $1,200 for your SSDI. You could get a job that makes $4,000 a month, $6,000 a month, and you're going to make $6,000 plus the $1,200 SSDI check every month for 9 months. And at that 9th month, you have the option where you can either continue to work or it just didn't work for you. It was too much physically and mentally with your disability to continue to perform at that high of a level, and you can just stop. You can tell the employer, this is too much for me. I'm not able to perform it, and my leg doesn't support this. My medical diagnosis doesn't support this, whatever. And you literally can just leave. You put your notice in and you get out before the 9th month. And you choose that you want to stay on your Social Security disability because you just can't maintain that over time. You are not penalized, but on the reevaluation form that you get from Social Security, you have to explain to them those 9 months. They're going to ask you why, if the SGA in 2023 was only 1470, why did it show that you made 8,000, 6,000, whatever it is? Oh, that was my back to work trial, month 1. And then you can go through and you can justify, as I had shown you on this sheet, right? You can justify that the one where it says in that last column qualifies for benefits, even though those 9 months are auto-generated to say no, because the number you made is bigger than SGA, they actually waive that because those are the 9 months of the back to work trial. So now, if this is the scenario, and this is one of many, you've now padded your pockets financially, you've tried to get back to work, and you're in a better place financially to make some decisions for your future. Another way that cat can be skinned is you could try a couple of different jobs. We all want to get back to doing things that bring us joy. So say there are 3 different avenues of employment or jobs that you're thinking you'd like to do, but you really don't know if you're going to be able to sustain it and at what cost, mentally or physically, to you with all the things that you deal with. You can try one job and do it for 3 months. Get that extra money, keep your disability income, and then figure out, is this what I want to stay with? And if not, you can just go. Now you have 3 months that are documented above your SGA, and you still have 6 months that you get to use in whichever way you want. So you can break those months up any way that you'd like, as long as you do not exceed 9 months where your earning is anywhere over that 1470 SGA from this year. I'm going to pause for a minute. I want to see who's with me, what questions you might have. Is there a scenario that you know of or think of that we could talk through? Because it was a lot of information. So I want to make sure that that I've got you all and that I answer anything you might ask, any comments or questions at all about that. No, I was able to make something perfectly clear at 6:30.
Okay, I got a quick question. During COVID, when the people gave you the president gave you money, did what Social Security did to me, that was not supposed to be considered earned income, that money when the COVID gave out, what was that, the rebate for COVID, like when you were sick? They tried to consider that earned income to me and tried to stop my Social Security, saying that I made more money than I was supposed to be making. And what was it? When COVID came out, they gave people money.
Has anyone else experienced that? I got a COVID booster, whatever that was, and that did not go toward my earned income. So Stephen, were you able to fight that successfully?
Yeah, I fought it and won, but yeah, and then I don't know for anyone else, they told me I cannot have more than $2,000 in a checking and savings account, or they'll stop that too. If I have more. Yeah, if you have more than like $2,000 in a savings or checking account, they won't give you your next month's payment because you have money saved.
Yeah, it's again, the burden of proof. I think the big take home from this for everybody is that the burden of proof is always going to fall on you. So even if you know you're doing the right thing and you're keeping your SGA limit and you're playing by the rules, unless you maintain vigorous documentation of that, you can and oftentimes do still get burnt if you can't provide that at the drop of a dime, because you could just literally get a letter in the mail, most of us just going about our day with all the stresses of living with a disability, and all of a sudden you see this 8x11 mailing
Yep.
from at Social Security. How many of you guys sitting here have gotten that and your heart drops? You're like, oh gosh, what's going to happen now? Because either everything's fine or you're in the middle of a big situation, and it just depends on what you have organized and kept track of. So that would be my biggest advice. And I wanted to just mention what's in the comments. So Sean, who's here with us today, he also said he wants to second what we mentioned about verifying everything SSA sends you. They do get it wrong and assume you'll have to prove everything. Sean, do you have a personal experience that you can share with folks related to that? You're on mute, hun.
How about now? Did that do it?
It's good.
Okay. So I know that when I had gone through a period that I was getting supplemental payments from a job that I was working that was part-time, we had to go through and jump through tons of hoops to basically get the employer to say, like, he's not working over X number of hours a week and not getting this amount. And we had to go back and correct, I think it was almost like a year's worth of benefits that they had the wrong numbers for. And eventually we did get that settled, but it was not a fun time.
Yeah, thank you for saying that. That's the other good point that I hadn't mentioned. If you are self-employed, or if you are earning a very low amount per hour, they can sometimes qualify your substantial gainful activity, not just as the concrete monetary amount for the SGA, but they can factor in the hours worked in your pay stub to determine whether or not you have more capacity than what you're stating. So for instance, if you own a business or you're doing self-employed work, if you have over 25 hours per month, the higher that number and the more consistently you're doing that number, the more that someone could make a case that you could get a job. So what I've found in people that are living with just genuine disability and just trying to financially make the best situation out of it than they can is that they don't often work much more than 25 hours in a month, because that keeps them feeling well, not having to sacrifice. So many of us with disabilities will work so that we can make money to live, but then we are awful for our families, hurt, there's a lot of stuff that we have to manage on the back end to make that work. So great comment about the hours, Sean. Thank you for that. So make sure that when you are getting payments that you do review those pay stubs to ensure that it is an accurate reflection. Pay date, pay period, so check date, pay period, hours worked, and total gross, right? So make sure all of those factors are in alignment and dispute them with your employer to make sure that your paper trail on a current, maybe every quarter, you just check back in and you make sure that things are cleaned up. I wanted to just also go backwards a little bit and say, when the Social Security Disability company makes an eligibility about whether or not you are permanently and totally disabled, the definition, I wanted to read the definition in case folks haven't referenced one of the ssga.gov websites I sent you. So the definition of disability under Social Security is different than other programs. They don't make it easy for any of us, right? Like, it's almost intentionally so hard. They pay only for total disability. So no benefits are payable for partial disability or short-term disability, right? So we're talking about SSDI, Social Security Disability Income. They consider you to have a qualifying disability under their rules if all of the following are true. All of these following comments. There's 3. You cannot work and engage in substantial gainful activity because of your medical condition. and you cannot do work you previously did or adjust to other work because of your medical condition, and your condition has lasted or is expected to last for at least 1 year or to result in death. And it goes on to say this is a strict definition of disability. The program's rules assume that working families have access to other resources to support periods of short-term disability, workers' compensation, insurance, savings, investments. Essentially, they hope that you have other measures in place. So the way that they further go on to say, if you have a qualifying disability, is there's 5 major questions, and they're: are you working? Is your condition severe? Severe meaning limit your ability to do basic work activities, lifting, standing, walking, sitting, remembering for 12 months. And that it interferes with basic work activities that you could do. The third question is your condition found in a list of disabled conditions that they acknowledge and they believe is severe enough? So I'll put that list of impairments also in the chat, guys. So this is the 4th reference that I'll put in, okay? So that you can actually see. It's helpful to kind of know exactly what they feel is a listing. And they'll go through and talk to you about, like, if you look at the left side, there's a tab that walks through different disabilities. The 4th one, I'm just going back and forth, sorry, between my charts here. Anyone else's computer does not like to work? Can you do the work that you did previously? And then the 5th is, can you do any other type of work? And this is the part that really irks me. I have a medical degree, 8 years of college, $160,000 in school loans. I was an amputating physician assistant in the OR. But could I be a secretary sitting all day for a library? I mean, sure. I wouldn't even make enough money to pay the payments of my school loans, though. You know, so this is where it gets very gray. And this is where there is also state to state variation in the interpretation of this information for you. So if one rep from a state based on local state politics reads your application, they may say yes. But if that same one was read in a different state with their politics and their influences there politically, they could say no. And that's the reason why a lot of lawyers, like you mentioned, Stephen, could get involved, because there is that aspect of some wiggle room between the interpretation of what's occurring. I think we have some questions. Marianne, do you have a question? I think you're on mute.
Okay, thanks.
Yeah.
So I'm a quadruple amputee to sepsis / septic shock.
Okay.
So I don't have my hands and my toes, and I'm going around the house. And my previous job was working for the county schools as a teacher assistant. And a lot of that requires running, not running, but we can't run the hallways, hello. But, walking up and down, Xeroxing, managing, helping the teacher manage the kids, walk around. But for crying out loud, I get tired just doing, like an hour and a half's work in the house.
Right.
I'm exhausted, then I have to take a shower, and then I get a little bit more energy, but I don't know if, I hope to get back to work, I'm trying to get out to exercise, but, by the time I have dinner, I'm wiped out.
Yeah, no, I can 100% relate to that. I don't have the extensive nature of your amputations. I'm just a single leg amputee, but I will share a piece of information. I love to spew whatever info I have, and then we'll kind of address your information more specifically. But working in vascular practice, one of the things that I read in one of our textbooks. So
I'm sorry to interrupt you, but I had Dr. Attinger, by the way. I don't know if that name rings a bell.
Yeah, so I read in this book, a single leg amputee at the below knee segment of amputation requires 30% more energy. Their total energy expenditure for their day is 30% higher to get around, whether it be the compensatory mechanisms of ambulating on a prosthetic or their accessibility equipment. A single leg above the knee amputee is 60% more. And it's summative So bilateral below the knee amputees, people that have an amputation below the knee on 2 legs, is 30 and 30, it's 60. But an amputation that's on both legs above the knee, 60 and 60, that's 120% more energy you spend getting around. So for you, Marianne, to put this in, are you a bilateral below the knee?
I'm bilateral toes, so I don't know if that's considered, I mean,
Yeah,
below
I mean,
the knee.
it would still be a percentage, but you have to take the factor of all of those amputations and all of the compensations that are occurring in your body for you, even just mentally, for you to think about the way that you do things all the time in different ways. And it's so much more calorie and energy that you require to do what you're doing. So that fatigue, that exhaustion that a lot of people, a lot of us feel when they're doing things or toward the end of their day, it's because you're exceeding the capacity of energy that you have due to the deficits that you have physically. And so a lot of us as we age don't necessarily have just worsening disability just because we're getting older. It's because our cardiopulmonary systems, our hearts, our lungs, don't have the reserve capacity to manage the additional 30, 60, 120%. And so there's exhaustion and there's like fatigue and aches and pains. And like, I just want to mention to you, Marianne, that like, you're not alone. And also there's like very significant anatomical and metabolic reasons behind why you feel the way that you feel. So then it's like, okay, well, that is what it is. What do we do with it? Right? How do I make the best of that? And it's so dependent on the person, right? It's like, it's almost, if you're looking to get back to gainful employment, the very first step that I advise people to do is to make sure that you link in with your local vocational rehab. Have you guys heard of vocational rehab?
Yeah.
And, just
DVR or something.
Yeah, it's just one place to start where you can meet with their social workers, discuss your capacity, your medical circumstances, and even if you don't have a plan to get back to gainful employment, but you like want to at some point in your future, it could be in 20 years, you get linked in with them and they can help with job searching, having conversations about capacity like that, having funding for certain things that could make your life easier in the home as you're transitioning out to the car or at work. So it is a good resource for people to tap into. But the other piece too is our days vary so significantly that one of the most helpful exercises that I did when I was determining what my capacity could be before I selected a job that I did my work trial with was I kept a journal for a month. And I wrote a couple of things, and always the first things I write are 3, 2, 1, nothing to do with work, but I would write 3 things I'm grateful for, 2 things that were highlights from today, and 1 thing that I'm excited about for tomorrow. Just because every time I put pen to paper, if I remind myself of silver linings and gratitude, it makes all the hardship easier. So I will just share that with you as a practice. But the next thing I would write would be energy level, brain fog or fatigue, mental fatigue, pain, and then just like a miscellaneous. And I just shorthand for an entire month. And then when I went through at the end of the month and I took highlighters, and there was 4 color highlighters, and I would highlight, the hard is red, the this is okay is green, the indifferent is yellow, and I don't really need to know this information at the end. I just kept not highlighted. And then it's a really quick visual reference for you at the end of the month to look and go, how many days are harder than not? And if they are higher than not, is it an okay time for me to get back to work? Or what constructs can I put in place to buffer against the retaliation that I have mentally and physically when I am trying to work, so that I can maintain homeostasis and balance in my life? And if anybody here or anybody that is ever looking to have conversations and some mentorship around that, because it is so customized and individualized and specific to you, you can always reach out to me and my organization. We'd be happy to help brainstorm and walk you through these kinds of things. Sean, did you have something that you wanted to mention? You're on mute too.
Yeah, just a couple things that I was thinking about as you were talking. And I wanted to kind of just share, keep in mind that any due dates or material that you receive from Social Security, assume that you're going to get it a month late, and the day before it's due to be sent in. They don't mess around with those dates. So if you are needing to submit anything, always send things with, get a receipt from the USPS that it got delivered, or take things down to the office yourself, because unfortunately, as Tina has said, it's all on you. It's all your responsibility to do it. And as negative as it may sound, they sometimes have, a multitude of ways that they can deny people benefits, and you want to give them as little reasons to deny anything as possible. And then the other two things I would just quickly add is, when you're applying for these programs, apply for whatever you think you could realistically get. Like, you can apply for food stamps and apply for cash benefits if your state has that, or WIC, or other benefits as well, like Medicare. Because all of those things will help supplement your ability to live your life and do the things that you want to do, and also cover the things that you need to be able to have covered. Because obviously for us, we all realize we have higher medical bills that we have to worry about. We don't just meet our, we don't worry about just meeting our deductible. We worry about how soon we're going to meet our deductible in the year that we're having all these procedures and things done. And then the other thing that I would just add is, make sure that you're on the same page with your doctors, because they're the ones who are going to be submitting their medical records for you to bolster your case that you have this disability. And the worst thing that I've seen from patients of my own that have gotten denied is the doctor's office makes a mistake in the record, and they submit all the records thinking they're 100% foolproof, and SSA reads it and is like, oh, but wait a minute, Dr. So-and-such said on this date you were doing okay and you were fine, and you didn't report pain, and you didn't report all of these other things that are impacting you. So, really be honest with your providers, as you should always be honest with your providers. But here's another avenue that you really want to make sure, like Tina said, you want to dot your I's and cross your T's really well.
John, I'm just so glad you're here. You're so articulate and you're such a wealth of knowledge. I'm so grateful for you being here. I hope we see more of you. But he brings up two awesome points. And this is why I'm so grateful for all of you being here, is because I have mom brain. I've got a little toddler. I'm running a business all day. I'm like, I feel like the chicken in Moana, just like, you guys seen that show? Just, if you haven't, it's really cute. The bird's name's Hey Hey, and you'll understand the reference once you see it. But the huge thing that he just mentioned is medical record review. If you're not already in a habit of doing routine medical record review, please take this as your PSA to do so, because there are a lot of medical errors that are documented differently. You wouldn't even know. And if anything comes up legally or medically or Social Security related, and there are wrongful things written in your charts that haven't been refuted, then you're out of luck. And so the only way to prevent that is to kind of comb through your medical records and doctor's notes and make sure that you understand what's written there, and that you agree that what has transpired as it's written is truly what's transpired. What you have been told to be received or to have received, you have received. What was stated to be done has been done, in fact. I mean, I can't tell you how many people in this room that review their medical records went and saw a doctor who didn't put a stethoscope to their chest or listen or touch their body at all, and they had a full body assessment written down in their doctor's note. Anybody else? Yeah.
Most of the time you go to the doctor, they say they do a full, they don't even check you half of the time.
Yeah, I mean, it really happens because there's auto-generated templates that go into medical charts. I'm a clinician. I've done this a lot. It's not like they do it on purpose, but they're working so fast, right? They're under reimbursed, they're understaffed, they're overworked. It's a hard system. And these templates, I'll open a new patient note and I get all of the preloaded information, your social history, your past surgical history, a preliminary template of a 9-point musculoskeletal examination gets imported. And then I change some things before I sign off. And all of that is for billing. So at the end of that note, when I click sign, things were auto-imported, not for my convenience as much as so that my billing department can submit it on behalf of the insurance to get money back. And the more things that are in it, the more money that they get back for the appointment. So there are a lot of ulterior motives. I say it deceptively, but there's a lot of things that occur outside of the interaction you have with the doctor that drive things that are written in your chart. And you just want to make sure that there haven't been errors. And so that's huge, Sean. Thank you so much. I used to do it
But
on a
also the doctors want you in and out. I mean, you know, they have a nurse come in and help my mom put my socks on so I can get out of the office once I'm finished with the doctor.
Yeah, no, I hear that. The other thing that he mentioned too, I wanted to share a personal experience. That whole review that I was telling you guys about, where I had to print all the pay stubs for 5 years and go back and go, no. And they said, mail it to us. So I mailed it to them, and I did not do the verified delivery, Sean. And so I called 2 weeks later. My local security office is pretty close by. No one had received it. You know, there's lots of people in the office. There's lots of hands things go through. So they said, come drop it in our drop box inside of the lobby. You know, it's like a locked box. And I said, okay. Well, thankfully I had kept a copy of everything that I had sent. And if I hadn't, that would have been a whole mess. So I took the copy, I made another copy of the copy, put it in a thing. I walked down to the office, just like they said. I pulled it open. I put it into the locked lockbox in their lobby. And I called a week later. They still had not received it. Somebody had like handed it to somebody, and like they couldn't find it anywhere. So on a third time, I had to schedule an appointment to make sure that my hands and my paper went into the hands of the person on my case. And so just another personal reason that like you have to be organized and you have to make sure you're documenting stuff, and that it's your responsibility. Do you have another thing, Sean, or is the hand still up? Oh, you're muted. Babe.
One other thought, also on the medical records side. So my mom was awesome and helped me get my disability my first time around. And I can't tell you how awesome it is to have someone who can advocate for you and be that clear-headed person that can read through everything you're sending. But also, if you have someone helping you do that, make sure that that's documented in their application, but also with your doctor's offices, because a lot of times HIPAA will prevent or obscure the ability of the physician's office to communicate with that person. And you have to go through all those hoops and sign the paperwork and do all of that stuff. And I know it's annoying and frustrating, but you know, as Tina can tell you, you know, we both live and work in healthcare, and so you know, we live and die by those forms. And so again, it's just one of those pieces that you just want to make sure you've got everything that you need so that nothing can get snagged on.
So true. It's so frustrating up front, but it saves so much work on the back end. HIPAA is a great thing to mention, right? The HIPAA law that helps protect us from having our medical information shared with any party that we haven't authorized. So you have to make sure that if you have anybody involved in your cases at all, whether they're handing off documents, talking to providers, getting phone calls on your behalf, that you've signed a form with the office. And sometimes they're not proactive about it. And so you have to go and say, at the beginning of every next appointment that you guys all have in your life, say, you know, if you have a loved one that is okay in the event that you needed them to receive a phone call on your behalf or coordinate something for you, just make sure that the HIPAA form is signed at their office, and it saves you trouble on the back end. I did want to delve into some of these quick questions. I know, I can't believe we only have 5 minutes left. It didn't go so fast. All right, so first of all, Jennifer Barlow is with us today. She can't do video because she's actually had a surgery on her head, and she sent me a picture. And so I just wanted us all to put our hearts up and tell her that we hope she heals well, and we're so grateful that she's here today, and we hope her a speedy recovery. The other thing we got was that someone mentioned, Stephen, you mentioned something about your $2,000 and the fact that there was some issue with
like at the end of the month, like if like at the end of the month before I get 1 month, I get one check on the first, one on the third. So I had more than $2,000 at the end of the month. Yep.
I want to clarify the questions to see if you can speak to it. So the question was, will you clarify the $2,000 in the bank account comment? What I have came from an inheritance, and I know that that's not considered earned income, but now I am concerned if they check my accounts. Can you speak to that at all?
I know for me, Social Security checks my accounts. Certified. I have to sign a form so they can. I mean, what was crazy? They even had a lot.
Well, I think you got muted, Stephen.
They said like, well, what does that have to do? Like earned income, kind of like at one point they were like, this is a good one too. They were like, I'm a single parent, so I have a son. He's a 17. I've raised him all my life. They were like, when he goes to work, if he still lives with me, his income could affect my Social Security.
Okay, let me see. Sean, what do you have to say to this? I have a comment, but I want to hold to see what you have to say. Thank you, Stephen.
Can you hear me?
Yes.
Okay, sorry. So I do know that from my experience, like because I live with my parents, that their income is considered separate from mine. But I do also know that when it comes to inheritance, there are certain rules and regulations that depend on your state of residence, not just the national Social Security, but how that income gets reported and how those assets get reported to various agencies. I know that for my mom and my parents' side of things, they are looking to put things into an ABLE account and a trust for me, so that when the time comes that should there be money that would go to me, that money wouldn't affect my ability to get my benefits and keep my benefits. I'm not really that well versed in those specific things, but I can say if you're concerned about that, estate attorneys are awesome to reach out to. They're the experts in that, and they may also be connected well enough in the legal community to help you get a good Social Security advocate lawyer. Because again, the laws are so complex, and unfortunately, I can't speak to that individual thing, but it wouldn't surprise me to say that, yeah, there is something on the books that says a certain amount of assets that you have need to be counted in your application for all of these. So it's probably a valid concern. I would definitely advocate reaching out to an estate attorney or a Social Security specialist.
Yes, and just so that you guys know, just piggybacking on that, there's a disability rights office in each state. So if you guys look at disability rights, DRC, you can find offices in most states, and some of those lawyers can actually do pro bono work. It's one of many resources. But the other thing I wanted to mention too is if anybody receives a Social Security disability income check and you have any dependents in your home, you actually can apply for your dependent to receive SSDI. So a person that I know, me, gets an SSDI check.
All right, I was gonna say, you get money for your kid, right?
And my son gets a check every month, which is like 50% more. So it's 50% of what my Social Security check is. I get to help take care of my son as well. And I didn't
get
know
that too also.
Yeah. So if you guys have a dependent and you have Social Security, it's a nice thing to assist for your ability to make sure you're taking care of yourself, make sure that you're not rushing to do work that you're really not capable, being able to do, so that you can tend to your child and care for them. So I just want everybody to know that that's out there too. We only have 1 minute left. Sean, I want to make sure I give you a moment to speak if you have a final thing to say.
So the one thing I would advocate for, there is a website, and I will put it in the chat. It's called disabilitysecrets.com. I think it's by a law office, but they have tons of information that's available online to peruse. And a lot of this stuff is a Google search away. So I would really advocate for that. So good luck, everybody.
Yeah, thanks so much, Sean. I really appreciate all of your information. And the last question I want to answer, Craig Allen asked, what if you found errors? Are you referring to the errors in the report that they send to you for the verification?
No, in the medical records.
Oh, okay. Thank you.
There's
Yeah, that's a great question. There are different policies and different practices. Like if it's a private practice versus an institution or a hospital, you can go to the medical records office if it's a hospital or a larger facility, and ask medical records what their process is to make an amendment to your medical file or refute something within your medical chart. Usually it's a document that you need to submit, but medical records department would be where you want to go to that for that. And then if it's a private office, I would just start with like the business manager of the private office, start there and see where you get. And then you would essentially bring the medical record that you have and the information that you feel is more accurate, and then follow whatever their policies and guidelines are. Just there's so many different ones. I don't want to answer your question wrong, but
Yeah,
those
man, that's
would be the
okay. That's a lot of work, man. I don't want to do all
and
that.
that's exactly why we
Yeah.
all find ourselves in a hot seat,
Yeah,
because it's the system is against us. It's all on
Right.
us to fight it, comb through it, make sure we double check it. And it's a lot of work, but if it's saving your capacity to receive benefits, if it's assisting in the further propulsion of your medical direction, then it's really important. So it's like, which evil is less? Sean, one more thing, and then we'll roll out. What do you got?
I think that's it for me.
Oh, okay. Your hand was up. Well, guys, make sure you look in the chat. There's all of the reference links. When I close Zoom, those are going to go away. So please make sure that if those links are of interest, that you click through them. I will also post them on the YouTube replay of this on our YouTube channel, which if you don't already know is there. You can link to our YouTube from our website, lesslikemoreheart.com, or you can just go in and type lesslikemoreheart.com on our YouTube. And we actually post these meetings. And we also have the TV show that I run. We post all of those videos and some other good content. So we'd love for you to follow along with us. If you have any other topics moving forward as we're starting a new year, we're going to do stem cell therapy next month. I'm really excited to learn about that. And I'm really excited to line up 2024. So if you guys have topics of consideration, questions, if you know people that either have inspiring stories or perhaps they have like health and wellness expertise, definitely send them my way so that we can make sure that this is a really fruitful, worthwhile hour of your time every month. And I just wanted to introduce you all, since he popped on, to the great, the glorious, no one better. He unmuted himself because he knew I was ready to introduce him. Mr. Craig Foster's with us tonight. Hello, Craig.
I'm looking around to see who she could possibly be talking about. How y'all doing?
How you doing?
What's up, man?
Everybody.
Guys,
Yeah.
Craig Foster is one of our beneficiary relations specialists. He helps direct our follow-up program in my program for Less Leg More Heart. And so if you get a chance to follow up with Craig, who's one of many now on our team, it's great that they can see your face and put a face with a name.
Yes. It's good to see everybody. How's everybody doing?
We're good. We're all educated.
Everybody's looking good.
Right?
Yeah. Okay. All right.
Bon, did you have anything else to add, sweetie, before I close off? I don't want to, or your hand's just still up. All right, fine. Well, guys, thank you so much for being here with me. What I always do at the end of these segments before you hop off is just beg that you can put up a half of a heart for me so that I can do a screenshot, so that I can tell my marketing person that I did the one darn thing she requested of me. And so hang on tight. Let me get this little screenshot set up. We'll do our hearts. Jennifer Barlow, you're off the hook. Debbie D, if we can see you, that'd be great. But if not, no pressure. Are you guys ready? Make sure your heart doesn't obscure your beautiful smile.
Yeah.
Free, and make sure your heart looks like a heart. Some people are like holding a hot dog. What's going on? All right, ready?
There
3,
you
2, fun. Marianne, your smile was just enough. It looked like you had the heart-shaped upper lip. That's good. I would love to connect with any of these new faces that haven't already. Go to my website, lesslikemoreheart.com. Go in the contact section, amputee in need, send us your info, connect with our organization, follow us on social media. Be here the second Thursday of every month at 6 p.m. We have some fun. We wiggle and wiggle, and we learn stuff. Love you guys. Have a good night.
Yeah.
Thank you so much.
Thank you.
Good night.